So today we will discuss about supracondylar fracture humerus in pediatric age group. The most common age group affected is 5 to 8 years. And now we will see the displacements in supracondylar fracture humerus. There is coronal displacement, sagittal plane displacement and axial plane or rotational plane displacement. So coronal is medial and lateral. Sagittal plane is the antero-posterior plane. So there is extension type and flexion type. The rotational displacements are medial rotation or lateral rotation or internal or external rotation deformities. So the most common type in supracondylar fracture is extension type. Among extension type, there are two types, posterior medial and posterior lateral, and posterior medial is the most common type. And the mechanism of injury is fall on outstretched hand. And the most common mechanism is fall on pronation of the forearm. Fall on outstretched hand with the pronation at the forearm. So we will see details about posterior medial displacements in extension type. So first one is the medial tilt. So the most common deformity occurring in supracondylar malunion is the cubitus varus deformity, also known as the gun stock deformity. The most common type is extension posterior medial type. And now we will discuss about displacements in most common type of supracondylar fracture. So that is the medial and lateral side of the bone. So medial tilt is the most common displacement occurring in supracondylar fracture. This medial tilt will produce a lateral angulation. So that is the coronal plane deformities in supracondylar fracture. Now we will discuss about the sagittal plane deformity, that is the antero-posterior plane. So antero-posterior plane deformity is the posterior tilt of the distal fragment, that is the extension of the distal fragment. The extension of the distal fragment will produce a anterior angulation. So the extension will produce an anterior angulation. So that is the sagittal plane deformity. Next is the rotational plane deformity. The distal fragment will get internally rotated. So the internal rotation is the most common displacement. So the internal rotation, the extension and the medial tilt together form this gun stock deformity in malunited supracondylar fracture. The most common age group affected is 5 to 8 years. Why? Because at 5 to 8 years, the maximum remodeling at supracondylar area take place and the antero-posterior width is minimum. So that is the most stressful area at this age group. So fall on outstretched hand can easily produce a fracture at this area. That's all for today. Thank you.